and welcome to the official graduation ceremony of students who undertook the Cert 3 Health Service Assistance qualification, provided by the University of Sydney's Poche Centre for Indigenous Health and delivered by Oten TAFE. I would like to acknowledge the traditional owners of this land on which we are gathered to celebrate today, the Gadigal peoples of the Eora Nation. I would also like to pay my respects to our ancestors, our elders past and present, all First Nations peoples, and particularly those traditional owner groups represented here today by our successful students. My name is Tanya Kirkegaard. I am currently working at Coloma in Gundawindi, an aged care facility with 80 residents, with varying degrees of nursing needs, mobility and cognitive impairment. I've been able to complete my workplace assessment whilst being employed at Coloma, allowing me to fulfil my requirements to successfully complete my Cert 3 in HSA. I am a proud and strong Bigabul Gomeroi woman, and I currently reside in Boggabilla. I was born in Gundawindi and have lived on my traditional country for much of my life. I applied for the Cert 3 HSA scholarship through Poche as I was looking for a change of career that was rewarding and satisfying. I always had a natural aptitude for health and a desire to heal, so it was an easy decision for me to make. I wholeheartedly and with faith believe that things happen for a purpose. And when I was notified that my application had been successful, I felt the universe was signalling and supporting me to make the changes my heart desired. My passion for health and healing goes beyond the physical, so achieving this qualification is the foundation on which I will build and strive to find answers and solutions to the many health afflictions of our First Nations people through holistic perspectives and implementations. My commitment and passion to improving the overall health and well-being of our First Nations people is strong, driven, and spiritually purposeful. On behalf of the students, I would like to thank each and every one of you for attending our graduation ceremony here today, and in particular, would especially like to acknowledge and thank the Poche Centre for Indigenous Health, Oten and Health New South Wales for their contribution and support in the delivery of such an amazing opportunity. The project is just one of the many programs delivered by the Poche Centre in conjunction with Oten, and the Cert 3 HSA sees 15 Indigenous students from across all of New South Wales achieving their certification in as assistants in nursing, a qualification which will provide us with the stepping stone to advance or start our careers, and has given us the confidence and strength to move forward into whichever stream of health is closest to our hearts. I am blessed and extremely grateful for the long-lasting and supportive friendships I have formed whilst learning and training alongside such wonderful people. My fellow students and future colleagues have provided invaluable and memorable experiences. Learning and studying has never been so much fun, been so joyous, or created such an enthusiastic and excitable atmosphere for block studies. It really has been the most amazing experience, and I love it. Thank you all. On behalf of all the HSA students, I would particularly like to thank, with honour and gratitude, from the bottom of our hearts, Rogers Kumar, Goranada Manchek and Sonia Riley, for their ability to make learning fun, for making us laugh every day, for all of the photo opportunities and the unimaginable number of selfies, and most importantly for providing us with an environment that transformed our experience of learning and study from what many of us had previously experienced. It has enabled and instilled a renewed vigour and thirst for knowledge, and will be what keeps us motivated to excel in all our future endeavours. I would also like to extend a heartfelt thanks to all the teachers and support staff of Poche, Oten and the Aboriginal Education Unit for their continued support and encouragement during our time of study. We particularly enjoyed the ability to socialise and interact with Poche and Oten staff outside of study hours. This allowed us to feel as though our needs were important and gave us the opportunity to build strong rapport with all involved. It really has been a very rewarding, successful and transformational journey for myself, and I'm sure my fellow students would agree with me when I say that we are ecstatically proud to be involved with such outstanding people, supported by such amazing organisations, and are truly grateful for your commitment to improving Indigenous health and providing students with such a wonderful avenue and opportunity to study. To the Poche Centre for Indigenous Health, Oton and Health New South Wales, the students wish to extend their gratitude and thank you wholeheartedly for this amazing opportunity to step closer to our dreams.